All right, so today we're diving into a really complex and sensitive ethical dilemma in our explainer, refusal of care. We're going to walk through a hypothetical case that brings up some of the absolute toughest questions in all of medical ethics. So let's set the scene. At the very center of this story, we have a hypothetical 63-year-old woman. She was brought into the hospital about a month ago, complaining of some pretty severe abdominal pains. After running some tests, the doctors came back with a devastating diagnosis, colon cancer. And the prognosis? Well, it's stark. They estimate she has maybe 1 to 2 years left to live. And this is where the whole ethical dilemma really kicks into gear. 2 weeks ago, she made a huge decision. She started refusing to eat. She's made it clear she just doesn't wish to live anymore. Okay, so let's really break this down. You've got a patient with a terminal diagnosis, a prognosis of 1 to 2 years, and for the last 2 weeks, she has been actively refusing all food. This single action, as you can imagine, creates this huge cascade of ethical and just plain logistical challenges for the hospital. So that brings us to the big question, right? What is the hospital supposed to do now? And this isn't just a medical question. It's a profoundly ethical one. You know, the hospital's first response probably isn't what you'd expect. Before they take any big action, their first goal is to simply understand why. Why is she making this choice? Because her refusal isn't just an action, it's a signal of something much deeper. So the hospital staff would basically go through a kind of checklist. They'd explore a few key possibilities. Is it possible she's misunderstanding her prognosis? Maybe she thinks it's worse than it is. Is her pain not being managed properly? Could this be a sign of clinical depression? Or, is it maybe a cry for more attention and support from her family? Their first job is to try and help in any of these areas. But, and this is the real kicker, what if they do all that? What if the medical team gets her pain under control, they provide psychological support, they clarify every single fact, and she still says no? She's firm in her decision. Well, this is where the situation goes from being a problem to solve to a fundamental clash of principles. And that leads us right to the core tension of this entire case. It's a clash between the patient's right to make her own decisions, what's known as patient autonomy, and the hospital's own set of legal and ethical duties to provide care and preserve life. Think of it like a balancing act. On one side, you have the individual's right, and really their duty, to make their own choices about their health. Their wishes are supposed to be paramount, even if we think they seem unreasonable. But on the other side, you have the hospital. It exists to promote health, and it has its own legal and ethical duties it has to follow. So where do you draw the line? So let's look at this purely from the hospital's perspective for a minute. Why can't they just say, okay, we respect your decision? Well, the institution has a very specific, logical argument for why it's not that simple. The hospital's logic really comes down to 3 main points. First off, cooperation is a two-way street. She came to the hospital to get help, to promote her health. By refusing food, she's no longer cooperating with that goal, which basically undermines her entire reason for being there. Second, there's the ripple effect on other people. Seeing her actions could be really disheartening to other patients, maybe even encouraging them to give up when their own conditions are actually treatable. And third, it's about resources. Every bed she uses, every nurse, every minute of a doctor's time, that's a resource that isn't going to another patient who actively wants treatment. Okay, so given that line of reasoning, what does the hospital actually do? What's the game plan? Let's walk through the potential courses of action they might take. The hospital has a pretty clear, though very difficult, path forward. Step 1 is exactly what it sounds like. They can ask the patient to leave. Now, if she refuses, things escalate. Step 2 is an extreme measure. They might go to court to seek an order that would either require her to leave or force her to accept food. But what if the court says no? That brings us to step 3, which is all about transparency. If they're legally forced to keep her, the hospital has to publicly announce that they're only doing so under legal duress, basically that the law is forcing them to act against their own institutional judgment. And even while they're taking these steps, which, let's be honest, can sound really harsh, the hospital would also be communicating its core mission. This quote really gets to the heart of it. They'd publicly reaffirm their commitment to the intrinsic goodness of every person's life. It's their way of saying, look, our actions are about our institutional duty, not because we lack compassion. And so, after all of that, we're left with a question that just has no easy answer. This whole hypothetical case forces us to face the boundaries of our most deeply held principles. Where does a person's right to make their own choices, even choices that are self-destructive, end? And where does a hospital's duty to preserve life and manage its resources begin? That, right there, is the question we're left to think about.